it is like having the constant, most painful UTI you've ever had in your life, but it never goes away. This is because the lining of your bladder is gone. It is missing. And this is your protective coating, the gag layer in your bladder. And when that is gone, anything you eat or drink that might pass through your bladder, it will be acidic. Imagine putting battery acid on a wound. So many menopausal women experience recurrent UTIs, issues. You can go into menopause and end up with interstitial cystitis. And how this can occur is when your bladder doesn't start getting the hormones it needs.
Hey there, I'm Bria, and welcome to the Period Whisperer podcast. If you're over 35 and ready for real answers about your hormones, you're in the right place. Hit subscribe and stay with us. Hey there, sisters. Welcome back to the Period Whisperer podcast. Today's episode is one that I know is going to land for so many more of you than I think we even understand for women, especially if you have been told that you have another UTI or you're having some issues down there. Maybe you've taken the antibiotics and you still don't feel better. Or maybe your tests keep coming back normal, but your body is clearly telling you something is not right. I have many clients that run into this. So we're diving into a conversation that does not get talked about enough and honestly is often misunderstood even in the medical world. And that's the connection between interstitial cystitis, recurrent UTI symptoms, and what's actually happening in the body during perimenopause. Because here is the truth. A lot of what gets labeled as chronic UTI isn't always an infection. And when we don't understand what's really driving the symptoms, we end up stuck in this frustrating cycle of temporary fixes, confusion, feeling like we're the problem, and you are not the problem. So today I am joined by someone who is doing incredible work in this space. Heather Florio is a sexpert, CEO, and powerful advocate for women's health and leadership. She's the second generation owner of Desert Harvest, a company specializing in medical grade pelvic and sexual health products trusted by both patients and providers all around the world. Heather has made it her mission to break down stigma, bring real education to women's bodies, and shift the conversation around sexual and pelvic health. And it from something that we avoid to something we actually understand. And in today's episode, right now, we're going to simplify what's really going on when it comes to bladder pain, recurring UTI symptoms, and how all of this intersects with hormones, microbiome, and your overall quality of life. So if you've ever felt confused, dismissed, or just plain frustrated by what's happening in your body in this area, I think this episode is going to bring you a lot of clarity. Let's get into it. Welcome, Heather, to the show.
Thank you for having me, Bria.
Yeah, I'm so excited. I'm very excited for this conversation. I was just sharing with you before we hopped on that I've had many clients come to me with this kind of quote unquote recurring UTI issue. And I had a very good friend recently tell me that she had something called interstitial cystitis, which I had never really heard about. So I'm excited to dive into that. But to start, I'd love for you to share a bit about your background and what led you into specializing in pelvic and bladder health.
It's kind of a twofold. It's both a family journey and a personal journey. As you kind of mentioned, many women suffer from conditions, pelvic conditions, urinary conditions, and have no idea which way to turn. Take many, many years or months to even get diagnosis or to even understand what's going on. And this is because we have so much going on in the pelvic region. And for me, it started as a journey. Actually, Desert Harvest was started in 1993 because my aunt had the bladder condition, interstitial cystitis. And, we have made some progress, but back then it was all in your head. It wasn't a real medical condition. Very dismissive in the medical community, and it was very difficult. And so we were trying to find alternatives that would help my aunt and try to find a way around the system because there were no options, let alone recognition of the condition itself. And that kind of led us to develop our SSAV specifically for interstitial cystitis 33 plus years ago, and it's now currently undergoing FDA drug trials, which we're excited about. So and over the years we've helped, hundreds of thousands of There is men, just understand, there's 75% women, 25% men with this particular condition. And then over the years, I actually got diagnosed in 2016 with interstitial cystitis myself. So whether it's genetic, there's a lot of thoughts of variation of the etiology. We still don't even know what causes interstitial cystitis. But I was diagnosed after having a hysterectomy, after having to deal with such bad uterine fibroids, endometriosis, PCOS, all at the same time. And then to find out that also my bladder was involved as well. So it then became even more of a personal mission to be able to do what I do.
That's so fascinating that one, it could be genetic. We don't know that it's still so new. And I mean, you're not kidding when you say there's so much that goes on in our pelvis. it's got-
Mhm. Yeah, and every woman has a story related to something, uncomfortable condition, or just a period in their life in which they went through, in which they were dealing with something related to their pelvic region. It's not exclusive to any one woman. It almost seems to be it's all women at some point or another.
Absolutely. And I think it has been quite normalized that so that we don't even bother bringing it up. Like even just like pelvic floor health in general with like leaking when we pee or lap or these or things like that is just we've all just kind of sucked it up and been like, oh, it's just part of having babies getting older kind of thing.
Oh, yeah, and that's the scary part. We did a campaign that we supported in the UK with the National Health System with Helena Bonham Carter, and she talked about how she was on the set of Harry Potter, and she would just be like, "Whoosh," but, she's in scene as Bellatrix here, and she can't, like, move or do anything, and she has to keep in scene, but at the same time, she's like, "This can't be normal," and had to find a way down the route to pelvic floor physical therapy, especially when it's regarding childbirth or any type of pelvic surgeries. It's so critical to have that pelvic floor physical therapy, learn the exercises to strengthen because you're putting so much trauma, so much pressure on your pelvic floor when you're having surgery or you're giving birth. And as a result, so many of us women deal with that impact and then think, like you said, it's normalized. So this is a normal thing and not a problem. But in reality, it affects almost every woman at some point or another.
Yeah, that's really wild. So I'm super curious about this interstitial cystitis and more understanding it, but I think that's maybe not always what's happening. So for women who are told they have like chronic or recurrent UTIs, yet maybe they even have cultures that come back negative, can you help us understand what actually might be happening in the body in these cases?
Yeah, so there are a lot of things when you get to that point. So the worst part is how we do the testing. So I'm sure many women have gone into the doctor, said that they think that they have a UTI. They've done the little dipstick test in office. They prescribed you some antibiotics, sent out your dipstick test for culture or your urine out for culture for further culturing. You've in the meantime, you've gotten these antibiotics, you've gone home, you started these antibiotics, and then you may or may not find out that it wasn't actually positive for bacteria, 72 hours later when that test comes back from culture. And so what this has led to is a massive amount of overbuy and overuse of antibiotics. But at the same time, we're dealing with the fact that, okay, so I don't have any bacteria, but I have the symptoms that feel like I have a UTI. What is going on? And there is kind of twofold here take, and we can delve into both of these, but there is a hormonal aspect and a menopause aspect. And then there is interstitial cystitis, which is a condition that, like I said, we don't really understand the etiology. It's theorized that it might be an autoimmune condition related to your bladder because it constantly reoccurs, but we're not 100% sure. But with I'll delve into interstitial cystitis first. So this one specifically, this is it is like having the constant, most painful UTI you've ever had in your life, but it never goes away.
Oh,
Yes. And this is because the lining of your bladder is gone. It is missing. So you imagine this is your protective coating, the gag layer in your bladder. And when that is gone, anything you eat or drink that might pass through your bladder, it will be acidic. And imagine like putting battery acid on a wound. This is essentially what is happening when you pass through. So now you have diet issues. You're dealing with frequency, burning, pain, waking up at night, nocturia to go to the restroom. Your body's waking you up for that response. And for many of these women, they take 10 to 30 years for diagnosis. We've heard these stories where they're suffering and they're in this cyclical environment of thinking that they have a recurrent UTI, they have a recurrent UTI. And then down the road, they find out that they have interstitial cystitis. And part of the problem that we have here in the United States is how we diagnose. So we diagnose as diagnosis of exclusion. So this is where women go through years of it, and they maybe have endometriosis, maybe it's this, maybe it's that, and they constantly go down, and then they begin eliminating all of these things, and then at the end, it's like, well, you must have interstitial cystitis. Well, this is a disservice because in the rest of the world outside the United States, they diagnose via cystoscopy. And it is an uncomfortable procedure, especially if you have interstitial cystitis. But it's essentially a camera growing up your urethra into your bladder and looking at your bladder wall for true bladder wall impact. So there is a lot of confusion in regards to interstitial cystitis because they think there was a theory at one point where we began lumping all these interstitial cystitis patients in because they had no bladder wall impact. This is another condition that has been subtyped out as called bladder pain syndrome. And this is a complexity. This is where that menopause would fall, neuralgia. So let's say you had a back injury. You can have radiating pain that can cause these bladder symptoms. And yes, just through your nerves. And so we can actually have a variety of different conditions going on that are not interstitial cystitis as well. So without doing a cystoscopy and looking inside the bladder, looking that you either have a very red inflamed bladder, it's ulcerated, you would be what's called bladder pain syndrome, and that's also deals with the pelvic floor. So if you have what's called a hypertonic pelvic floor and it's like super tight, imagine a dish rag so tight. This could be your pelvic floor muscles. If you go and you start doing Kegels while you're have a hypertonic pelvic floor, you're going to make that worse. And that can also cause urinary symptoms. And so that can cause the spasming and you can feel like you're having these symptoms that might be interstitial cystitis. But 88% of those patients that just have pelvic floor dysfunction, they resolve with pelvic floor physical therapy. 88% resolve.
Oh my gosh. Okay,
Yeah.
so if you're a woman listening and you've been having these like what feels like chronic UTIs, but not getting a positive culture back, it could be either interstitial cystitis or it could be, a difficult pelvic floor. It could be, some of these other issues in post trauma or what did you call it about bladder like
That all falls under the umbrella of bladder pain syndrome.
could either be bladder pain syndrome or interstitial cystitis. And the only determining factor is if we actually do a cystoscopy.
Yes, correct, and see true bladder wall impact.
Do they not do them in the US?
They very rarely do them. This is something that you can definitely request and you can definitely advocate for yourself and ask because it helps you go down this path to understanding what's going on with your body and understanding because, like I said, most just diagnose via diagnosis of exclusion. And we've really kind of separated these out into really two distinct conditions. I was part of this project at Wake Forest University last year where he said, no, we really need to separate these two out. You'd always see ICBPS together and as two conditions. And women were so confused and they were following down the route of interstitial cystitis, but maybe not having interstitial cystitis. So it's very important to understand that interstitial cystitis and bladder pain syndrome are two completely separate things. And bladder's pain syndrome really encompasses a larger complexity of conditions.
when we're talking, just to kind of close the loop on that, under the bladder pain conditions, how do our hormones impact that? Has this perimenopause transition and menopause transition impact that specifically?
Okay, so yes, so when it comes to now, you can go into menopause and end up with interstitial cystitis. And how this can occur is because when your hormones, your bladder doesn't start getting the hormones it needs, that same bladder lining begins to degrade. And so if you're not getting HRT when you need to be starting HRT and you start to feel these symptoms all the way from perimenopause all the way to postmenopausal, and you're feeling these symptoms and you're not on HRT, that is the best place to start. And that is because so many women can actually just resolve with being on HRT and getting the necessary hormones that kind of feed that gag layer. The problem becomes, and we have not done the research, what happens when you're postmenopausal and that lining has already completely degraded, which in some cases has led to those women actually truly having the true red inflamed bladder wall. So what happens if you start HRT after that point? We actually do not know yet, but the theory, it will support all the other symptoms related to postmenopausal symptoms.
Bioidentical hormone replacement therapy can be
Yeah.
preventative in a way if started, beforehand, before we like have those ovaries retire and we're completely desert in some of our hormones. If we start early, then that can actually prevent it from going all the way to interstitial cystitis. Do I have that right?
Yes, yes, but we don't know if that's progressing to interstitial cystitis, whether we call that another condition, but it is interstitial cystitis in appearance, and that is where we have a lot more research to do to really understand, but we know that there is this group that is experiencing so many menopausal women experience recurrent UTIs issues, and this is that result of that degrading of the bladder lining and the thinning of the urethra.
Really. I have had many, many clients when we finally see that it's safe for them to be on hormones and they get on their hormone, like say, "Oh, I'm not up peeing so many times in the night. Like I just feel better." So that okay, that explains that. That's how so
Yeah.
are there so let's say we have interstitial cystitis, like, are there holistic things that we can be doing to support ourselves? And maybe this is, like, both preventatively and actually if we're diagnosed with it. Um, yeah, what's, like, the first step, and then what are all of our options? I can already hear it.
There are there are multiple things. First, one of the best things you should do, just because as things happen, your pelvic floor begins to tense. One of the first things you should do is go to pelvic floor physical therapy and get the strength. And then they'll teach you exercises you can do at home. This doesn't mean you need to constantly go, but they will also decide the function of your pelvic floor. Is it hypertonic, that dish rag really tight? Or is it truly weak? Most women aren't actually in a weakened state. They're in that hypertonic state in most cases. And so it's really important to address your pelvic floor as part of this process. But then, secondly, the next most important thing is to look at, unfortunately, there aren't a lot of options that you can go seek as an interstitial cystitis patient. It's really just about self care, looking at things. Desert Harvest SSAV and our double blind placebo controlled studies, we've had an 87.5% response rate of some or complete relief of all symptoms with just taking our capsules.
Oh,
And so that's frequency, burning, pain. So this is why we have been doing this. Now, this isn't the aloe vera like you go get in the health food stores. And then that is a very, very important distinction. This was developed, over 33 years ago to be safe for long-term use and in high doses. And this is why we clinically research this. We're even further clinically researching this. We've even done studies with the, more questionnaire style with the Interstitial Cystitis Association. We had 660 respondents in that one and a 92% response rate. It's not truly clinically controlled, but, great informative information that we received there from patients from like foods and how they're controlling foods. And that's another really important part of interstitial cystitis is understanding. Don't eliminate everything from your life and make yourself nutritionally deficient. That is not a good place to start. We have heard people be like, "I only eat white foods." And it's like pasta, rice, potatoes, like you're doing your body a disservice. So it's very important that you keep up your nutrition, you understand. There's a list, actually, the Interstitial Cystitis Association. They're the only nonprofit specifically geared to interstitial cystitis patients. There are a lot of for-profit platforms, but just to understand that is the only nonprofit that works directly with the government on research. But they have a great list on their website of diet things that, kind of like this exclusionary list that really kind of helps guide you through that process. And it's more about keeping food diaries and understanding what foods work for you and what don't. Big culprits are definitely coffee,
Mm.
tomatoes, oranges, and sadly, ladies, chocolate.
Thing. Coffee,
Yeah.
probably the cocoa bean, I guess, is that was great.
Yeah, yeah, it's kind of the acidity levels within that. Those are all acidic environments, and then caffeine, the stimulating effect of caffeine can also, it cause issues with the bladder lining. So that's where the chocolate comes in, unfortunately.
Unfortunately. So that's an amazing resource. So they can go, they can look at this resource and obviously learn to kind of track and pay attention. But what we don't want to do is just, scale back and eat like the bare minimum of things for our overall functional health. And then this product that you guys have at Desert Harvest, SSAV. Does that stand for something?
Yeah, it does. That's kind of why I mentioned the aloe vera because it stands for super strength aloe vera. Really big long word.
Mhm.
But we really wanted people to understand and differentiate that this isn't, the aloe you go get in the health food stores. We utilize a patented process that we developed over 33 years ago, like I said, to make it safe for long-term use and in high doses. We start with everything. We grow where we grow it. We grow it at the base of a volcano, so it increases the nutrient content. The minute you cut an aloe vera leaf off of the plant, malic acid begins to eat away at the nutrients. So if you've ever seen the leaves in the grocery store, they're just expensive water. Just because within 6 to 8 hours, all the nutrients in an aloe vera leaf are dead. So you don't realize that you can't just cut it off and leave it laying around. It definitely needs, so within 20 minutes, we're in processing, making sure that we're preserving those nutrients. And it takes roughly 89 full grown, like 3, 4 foot long aloe barbadendis Miller leaves to make one of our 180 capsule bottles.
Oh my goodness, that's wild. How I assume you take them because
Oh, yes, every day.
how do you have any if and maybe I should ask this question first. It doesn't sound like you can it's not like you can rebuild that layer in your bladder. Like once you have it, you have it? Is it a forever thing?
So that is kind of the great thing about the SSAV, separate of the fact that there are over 200 nutrients in the aloe vera plant, 75 of them active. So that is what we're about maximizing. But then in addition to that, there are glycosaminoglycans, the same thing your bladder lining is made out of, the GAG. And so what we are doing, and we're actually studying this at Wake Forest and watching this in live time right now, because we know that it was coating the bladder, but we wanted to understand the mechanism of how it was interacting with that urothelial cell layer of the bladder underneath. Like, what was it doing? So we know that it's high in anti-inflammatories. We know it's high in analgesics. We know it has active enzymes, antibacterials, antifungals, antimicrobials, all naturally in the aloe vera plant itself. And so we just wanted to figure out how we could maximize those, but we wanted to understand exactly how they were interacting with that urothelial cell layer in the bladder. We know that it's coating the bladder. We know that if you fully stop the SSAV within 72 hours, that coating dissipates again. So this isn't like that's its kind of half life, but we know what it's doing with the glycosaminoglycans at least, and that it's creating that coating so that when things pass through. Now understand that even on the SSAV and even myself, if, I go and I have, drinks with the girls one night, I know that that glass of wine I just had might cause me some problems and I might take a few extra afterwards or before just to kind of help with that. You can have breakthrough flares, you can have stress is a big component. So as you stress out in that stress response, it can actually cause breakthrough flares to kind of break through in within your bladder. And we have you have to kind of like up the dosage with the SSAB. So like I said, we've been doing this for 33 years. So we have all of the scientific and safety data that we've been compiling and collecting from hundreds of thousands of men and women all over the world.
So freaking fascinating. It is. So you can still have flare-ups even on it, but they are most commonly driven by dietary breakthroughs, as you said, and certainly stress.
Yes.
But there's relief here, I think, is what it
Yes.
sounds like for most
Yes.
you.
Yeah.
Really quite painful.
Oh, it's a horrible quality of life. You've got to understand. We were actually part of supporting it, making it a disability through the United States government so that you could get on Social Security disability for this condition. And that is because that is how debilitating it can be for some. There are some that can't leave their house. We've had one girl, she was 13 and in middle school and literally, she couldn't go to school. Her parents made her a bed on the toilet where she slept because it was like 50 to 80 times a day voiding, and she had no quality of life. So we get to hear these stories, these amazing stories when they call us back and they're like, "She went back to school. You've changed." We even men, we had a man who was self-cathing as a cop on duty 12 times a day just so that he could keep working and doing his job. And so similar experiences, we hear all of these different stories of the suffering, the having to map out your plan if you leave your house on where bathrooms are, or to wear underwear to make sure that you don't have an accident while you're out. We see all of this and hear all of these stories, and it's very debilitating for these patients, unfortunately.
Sure, and, like, that's not even to go into, like, just the impact of, any intimacy, any, like, experience that way for women.
Oh yeah, the impact on relationships can be very difficult. This is an invisible illness essentially, and that you can't see them physically disabled, but you might see them running to the bathroom or you might see and so it becomes a really tough condition for maybe a family member to understand or your partner. And then when you take the facts that most of them do not want to have sex. Who wants to have sex? Yeah, all of us have had a UTI. Who wants to have sex when you're having a UTI? So imagine that feeling like that always, like, and not being able to do anything about it. Like that is the difficult part. And they want to have a quality of life. They want to figure out how to have intimacy again. Our Relivium, which is 4% lidocaine for bladder, especially for patients that have had radiation treatments. So radiation dermatitis on the skin and like vulvularly, vaginally, things like that. So we make this product called Relivium that is one of the top recommended by radiation oncologists worldwide for radiation burns, for the radiation dermatitis. And we find that those, especially we work with a lot of breast cancer patients, same kind of thing. They want to get back to that quality of life. Nobody wants to talk about, they just want to talk about getting to the end. But then people, as they're getting to the end and getting cancer free, what about my life? What about my quality of life? And the number one thing that they want to get back to is a quality of life of sex
Yeah.
and being able to either have sex with their partner or, just re-engage.
Yeah, after all of that trauma, I'm sure that's
Mhm.
intimate connector between people, so it makes
Yeah.
um,
It does.
is it with the SSAV, is it something that I mean, obviously, would depend on the situation, but is it, something that if someone is taking, they can expect to notice relief within a month of taking it, within a couple months? Is there any data there?
Yes. So in our clinical research, we did the study for a full 6 months. But what we found is if you were going to respond to the SSAV, you were going to respond within the first 3 months. So some people, yes, might have that immediate response and immediately feel something. Some might take a little bit longer. So actually, one of the things we're studying right now, again in our current research, is our escalation dosage protocol. So this is we've kind of tested this theory out over this 33 years where let's say month 1 you take 6 a day and then the next month you're not getting your full level so 9 a day and the third month 12 a day. So we're studying all of this to understand we find that those people that might take a little bit longer, we're trying to understand why, and we're also trying to understand why, what the increase does and how that increases their potential. But even then, we know that those patients are definitely, if they're going to respond, are going to respond within those first 3 months. And then we find that afterwards, you can maintenance dose down. So after those 3 months, you don't need to stay necessarily on the high doses 6 a day or 12, 9. You can begin taking away a capsule a week and finding a maintenance dose, and most people maintain on 1 to 3 capsules a day on average.
Oh, that's good to hear because it does sound when you think like 6, 9, 12 a day, I mean, listen, if
Yeah.
you'll be happy to take it, but it starts to feel like a lot of pills you're swallowing, right?
Oh, yes, 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 it's a lot.
That's so interesting. Is there anything else that I think women should know in terms of what they can be doing for themselves that also is supportive along with the SSAV? Or, when we're talking about, more bladder pain syndrome, hormone replacement therapy, and nutrition, is there anything else that you have found in your research to be helpful that's easy for women?
Yes. So one of the other things, and this is a good time of year to talk about this, is allergens. So we find that a lot of women have the mast cell activation component. Not all, but there is a good majority. And so actually, what we call this is the allergic bladder. And so literally during the high allergen times, you can begin flaring, thinking that something's not working that was working before. This is that same thing where, like, we say, like, breakthrough flare, this might be more of an allergy response. And as a result, the typical go-to over prescription would probably be things like hydroxyzine, things like that. But that causes you can only take it at night, and it definitely leads to severe fatigue the next morning. And so it's one of those things, like, you have to balance in your life. The great thing is quercetin, which is from the Sapora japonica plant. That actually, is a natural flavonoid that can have a similar response and has shown in clinical research to do so. And so, like, we even have, a quercetin back in the day before even I think COVID made quercetin actually kind of popular because they were using it in their cocktails and stuff like that. But, we actually nobody knew about it before then, and we used to have to, like, harvest it only once a year because there was no way to preserve it, and we had to determine how much we needed for an entire year at one harvest, which was in July, August, roughly, in Japan. And and then guesstimate, get everything that we needed, and hope that we had enough to get through the year. And so now we have preservation methods, and we're in a much better state, and that was actually thanks to COVID. So, that happened because the need for it became much larger.
Man, that's so fascinating. I've just adored this conversation, Heather. It's been so interesting to hear, like, and I can see your passion in it. Obviously, I can see the impact that it must be having, especially for people going through this. What a frustrating situation. For the women who are listening, and I know you said so. Let me clarify this. I'm getting ahead of myself. Outside of the U.S., is it a very common thing to do a cystoscopy if there's symptoms here?
Yes. Yes, for the rest of the world, you only have interstitial cystitis if you are diagnosed via cystoscopy and have true bladder wall impact. And understand, even like in Italy, they actually do exploratory laparoscopies where they actually go in and go as far as to make sure. So one of the things, this is also called an evil twin, bladder endometriosis. You can have stomas on the outside of your bladder and sometimes even on the inside. But you can have stomas on the outside and have bladder endometriosis, not have interstitial cystitis, and we would never know. Now, obviously, we've got new diagnostic tools for endometriosis coming that are going to kind of be a game changer and not have to lead to exploratory laparoscopies and things like that, and we'll have better diagnostic to actually be able to diagnose interstitial or endometriosis in a better way. But that is kind of an evil twin as well. So,
Oh, interesting. This obviously, has like connecting dots back to just the massive gender gap in women's and men's
uh yes, yeah, we have a long ways to go.
with the women listening, I mean, anywhere in the world, but maybe especially in the US, if if we know that cystoscopy is not a common thing to be done, what do you feel like are the most important questions she can ask her provider if she's clearly having this pain, knows something's not right with her body, not having a diagnostic response saying that there's a culture. Yeah, what would you recommend?
I would recommend asking for a cystoscopy. There's no reason not to ask for it. You can get and see just to understand that this is not a comfortable procedure. If you truly do have interstitial cystitis, it can be painful, it can cause a flare. It's why they kind of started to veer away from it because it was, and there had been studies trying to diagnose via urine cultures, but we've done ourselves a disservice by making it a diagnosis of exclusion because there's a lot of women that are diagnosed with interstitial cystitis who don't actually truly have it, and as a result has really muddied the waters of research. And so when they did this I think it was University of Pennsylvania did it, and they were unable to find any consistent biomarkers within urine culture. So we have no other way to really truly diagnose right now other than to do that cystoscopy, look with that camera up the urethra and see that true bladder wall impact. Just to understand that research has evolved and developed. And if you do not have bladder wall impact, you should be talking to your doctor about other conditions and not just labeling that you have interstitial cystitis because so many women over the years have been diagnosed with interstitial cystitis and had no bladder wall impact. That is bladder pain syndrome, and that is completely different, and you have to look at that as a completely different complexity that we have to unravel in a different way. And whether it's hormonal, whether it's, pelvic floor dysfunction, whether it's neuralgia related, that has to be unwoven by your doctor. And there are amazing doctors, and again, I'll mention the Interstitial Cystitis Association because they have a provider directory on there, and those are the doctors that are actually truly seeing interstitial cystitis patients. You could go to your urologist, and a lot of urologists do not see interstitial cystitis patients. A lot of them specifically urogyn's are great, though, for women because that's your option where you can kind of get your all-in-one. They're gonna dive deeper and you'll get a little bit more better of standard of care than a traditional urologist that might be focused on, kidneys and surgeries and prostates and other things like that that have nothing to do with you, and might not necessarily be dealing with the chronic pain condition. So urogyn's are a great advantage for women now.
Heather, this has been amazing. Honestly, I think like even I know for the women listening, I think you've given them like some really clear focus to understand and even help themselves. I feel like as a practitioner, it's helped me think like, okay, now how can I help and point my clients and give them information and point them to you in ways that can provide relief. So thank you. I'm so grateful.
Oh, yeah. I mean, we are always innovating. We're always looking. We're always trying to research. We're actually studying our lacto. We just came out with the world's first human lactoferrin, and Yeah, so this is a glycoprotein, and what lactoferrin does, so this is what's in those breast milk in the colostrum in the first few months of life, that glycoprotein that bodybuilders want, that they buy breast milk on the black market for. This is what they want. They want the lactoferrin. And it is an iron binding glycoprotein. So what it does is it's going to create iron homeostasis. So if you are menstruating and your iron levels drop or you have painful periods, this is where lactoferrin can make a difference with that. We're actually studying it for adenomyosis and endometriosis right now because we are finding that the stomas actually kind of begin to reverse in some cases when it comes to lactoferrin in initial research. And so we haven't fully proven this yet, and so we're looking forward to the data coming out. But we know that endometrial stomas and the endometrial tissue go through the abdominal cavity and that they float and feed off of iron. And so we're thinking if we can create the iron homeostasis so that that doesn't happen, then they don't have anything to feed off of in that way.
That's interesting because obviously so many women in midlife do start to have issues with iron conversion, iron storage, iron absorption, or so that's gotta, make things a bit rickety. So to be able to bring it into that homeostasis is probably huge for a lot of reasons.
Oh, it is. I mean, especially menopausal women, as you stop menstruating, it's going up and you could end up at hemochromatosis levels. And we've even shown that it brings that up from hemochromatosis down to homeostasis.
Wow. So you would take lactoferrin when as a woman?
So there are multiple reasons. You can take it for menstruation. You can take it for menopause. There are additional benefits. This thing is this can help with exercise performance. It can help. It's going to optimize gut function better than pre or probiotics. It's going to synthesize collagen better than your own collagen, better than supplementing collagen. So the benefits of lactoferrin, we are just scratching the surface, and especially because this is human. Everything else out on the market that you find is from cows. Doesn't function the same way in the human body. So we wanted to figure out how we could optimize actual human lactoferrin from women and be able to replicate that. And that's what we were able to do with an amazing company.
That's so cool. I feel like
Yeah.
the science geek in me is just so satisfied right now with this conversation. So thanks.
Yes, 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 yes. So we're always doing things like this. We actually have the one of the world's first ever created pelvic wands that would create. It was created by a dear friend of mine in 2000, which is made of a borosilicate glass, and so that you don't have to worry about bacteria trapping in it, and it can be heated or cooled depending on your needs, and you can use either end, either internally, externally, so it can be used vaginally, anally.
Oh my goodness. That's
Yeah.
interesting. Do we okay, and before I ask you where we can find you, because I know that might be the logical next question, did I miss anything? Is there anything else that you really think that women listening should know about this area?
I think that the importance is just remember to advocate for yourself. Remember that Google is not your friend when it comes to medical, and you'll get 10 different things and 10 different stories and 10 and realize that just follow that path of research and advocacy for yourself, that you have the ability to demand and ask for what you need. You don't just have to follow the course. And so if you think you might have interstitial cystitis, you can ask for a cystoscopy. You can ask and advocate for what you need and for what you want. And if you don't have true bladder wall impact, but you were diagnosed with interstitial cystitis, go back and ask. If you have recurrent UTIs, there are options out there. Just realize that I guess this is one I didn't cover. Demannos has just made me think. So this is the typical go-to if you do have bacteria positive recurrent UTIs. And if you are dealing with recurrent UTIs that are bacteria positive, realize, and you're saying, you went to the standard go-to Demannos, that only in clinical research binds to E. coli bacteria. Just know. Now that accounts for about 80% of gram positive bacteria for UTIs, But we have this other 20% that is usually the stubborn recurrent UTIs. And that's where you need to think outside the box and think and research the different bacterias you have. We just developed Heather's UTI defense. We've been doing clinical research over in the UK at Oxford. And we were actually able to show in research that it binds to three bacterias. So E. coli, E. fascialis, and P. vulgaris. And we're studying two other bacteria. So we're always looking for ways in which we can provide more options outside of the traditional route, especially when you're dealing with antibiotic overusage.
Yeah, for sure. That just, in my land wipes out that gut microbiome, and then that can create a whole other host of problems if we don't come back.
Yeah, and it is just destroy it goes from the gut to the vaginal, to the urinary microbiome to the vaginal microbiome. It just becomes a destroyer in so many ways.
I'm so glad you added that at the end. I think that was really, really important. I think I missed that somewhere in there, so thank you. Yeah, thank you again so much. We're for everyone listening, like, I know there's gonna be women who want to just get into your world, who want to look at this SSAV and some of the other products that you guys make that you talked about and the research that's coming. Where do we best find you?
Yes, so that's our website, which is desertharvest.com. They can check us out on Instagram, Desert Harvest Aloe Vera, same thing on Facebook, TikTok, all of that stuff. And I'm also on Instagram, HM Florio, usually trying to provide information and tips and information from all the amazing clinicians I get to work with and learn from.
Awesome. I'm gonna make sure, sisters, there'll be everything here in the show notes. I really want you to, reach out to Heather, get into her world because, I've just loved this. I can see your passion, your energy here, and it's amazing the work that you guys have done. Thank you so much for your time today.
Thank you so much for having me and letting me put this information out there.
Yeah, I'm very excited. I will be sending this episode probably even before it goes live to my friend who needs it very much. But thank you, yeah, for everything, sisters. Now you have an amazing tool and some incredible information backed by research to be more in your life and not just less on a scale and certainly not suffer. So, thanks again, Heather, and sisters. We'll catch you in the next episode.
If you're 35 plus and ready to stop guessing, start understanding your hormones, and feel your absolute best, hit subscribe. That's what we do here.